Have you ever tried to tie your shoes or type a 10-page paper with only one hand? It would probably be difficult and frustrating, right? Well, that's an everyday reality for a post-stroke patient like myself. Hi, my name is Madeline, and I have had 6 hemorrhagic strokes and continue to live with post-stroke spasticity. My left hand constantly wants to tighten up and curl up into a fist. This limits me from being able to complete everyday tasks that once required little to no effort. Now I have to come up with creative ways to do simple things such as tie my hair up into a ponytail or button up my shirt. But even these ways don't get the job done sometimes. The rest of this video will discuss different types of strokes, as well as define spasticity. It will further discuss different treatment options for post-stroke patients with spasticity.
Strokes are the 5th leading cause of death in America and a leading cause of adult disability. A stroke occurs when blood flow to an area of the brain is cut off. This disruption in blood flow may occur from a hemorrhage, resulting in a hemorrhagic stroke, or a blockage, which results in an ischemic stroke. Without sufficient blood supply, brain cells are deprived of oxygen and they begin to die. When brain cells die, the functions associated with the affected portions of the brain are lost. The extent of functional impairment depends on where in the brain the stroke occurred and how badly the brain was damaged. Post-stroke spasticity is the most common post-stroke side effect. Spasticity is the result of brain-muscle miscommunication, which may occur anywhere along the neural pathway from the brain to the spinal cord. As previously discussed, during a stroke, neurons are damaged. Spasticity is caused by damage to parts of the brain that send messages for the neurotransmitter gamma-aminobutyric acid, also referred to as GABA, to be released. GABA is the primary inhibitory neurotransmitter of the brain. When it is released, it suppresses the activity of the receiving neuron, reducing the probability that it will fire. Without GABA, to inhibit muscle contraction, an overwhelming excess of excitatory impulses causes the affected muscle or muscle groups to contract. It's important to note that spasticity occurs on a spectrum. Some patients may only experience mild tingling sensations or tightness of certain muscles, while other patients may experience muscle spasms, causing uncontrollable and often painful muscle contractions. Spasticity is treated case by case, but the common goals of various treatments are to relieve the signs and symptoms of spasticity, reduce the pain and frequency of muscle contractions, enable activities of daily living, and improve voluntary motor functions, such as reaching for, grasping, moving, and releasing. Treatment may involve any combination of medication, surgery, and physical and/or occupational therapy. It is important to note that medication is used to provide relief from the symptoms of spasticity and not treat the underlying condition. Thus, this is a short-term solution. Medication may be administered via injectable or oral forms. Injectable interventions are locally administered medications applied in order to reduce pain, increase range of motion, and decrease muscle tone. Most commonly, botulinum toxin, or Botox, is injected into the affected muscle or muscle group in order to paralyze an overactive muscle by blocking the release of the neurotransmitter acetylcholine, which signals muscle contractions. Botox injections generally last about 12 to 16 weeks, at which point new nerve endings begin to grow. Notably, however, there are limitations to the number of injections a patient may receive. Unlike injectable interventions, oral medications are non-site specific. Systemic medications may have adverse effects on a patient's day-to-day activities or sleep. It's important to monitor side effects closely. Surgery is not always an option. It is important for the patient to weigh the benefits and risks of surgery with their doctor. The primary neurosurgical procedures to treat spasticity are intrathecal baclofen, or ITB, pumps, and selective dorsal rhizotomy, SDR. Physical and occupational therapy for spasticity is designed to diminish muscle contractions, increase range of motion and mobility, and strengthen affected muscles. Common forms of therapy may include limb positioning with assistance of braces and casts, electrical stimulation or TENS units, and stretching or strengthening exercises. With therapy, repetition is key, as you are ultimately retraining the neurons that lead from the damaged part of the brain to the affected muscles.
Now that you have learned about the different types of strokes and what spasticity is, we are going to discuss therapeutic ways to help reduce spasticity. Here I have a Sabo stretch splint. This splint is to be worn overnight and keeps the hand in a neutral position while you are asleep. The straps work against the muscles from tightening in efforts to alleviate prolonged muscle contractions throughout the night. Keeping the hand in this neutral position also helps to retrain the neural connections between the hand and the brain to remain in a more relaxed state. Persistent activation of those muscles causes them to strengthen, which only makes it more difficult and painful for the individual to work against the spasticity. The straps assist in reducing the intensity of the spasticity by preventing the hand muscles from constantly contracting throughout the night. Another way to reduce spasticity is with an electrical stimulator, also known as a TENS unit. By placing the electrodes on the antagonistic muscles, which work against the affected spastic muscles, the E-stim retrains these muscles to become dominant over the spastic muscles. For example, since my hand wants to flex into a fist, I put the electrodes over the extensor muscles that allow my hand to open. This technique should be used for about an hour at a time and used at a frequency that does not fatigue the muscle. Repeatedly activating these muscles helps redirect the neural connection from the brain to perform this desired movement with more ease over time. Thinking to work with the muscles when activated further assists in redirecting these neural connections.